better than a criminal one.
As a therapeutic substance, marijuana has been used by many cultures for centuries. Yet in the United States, medical marijuana is still the subject of great political, legal, and cultural controversy.
It does strike me that the medical use of marijuana softens up the public in the sense that they no longer, if marijuana can't be a reefer madness killer drug, if it also aids cancer patients and AIDS patients and MS patients and lots of seriously ill people have their symptoms relieved. In some cases, it's even more than symptoms. It actually deals with the underlying condition. But again, I want to make this point. I don't have any interest myself, and I can tell you NORML has always said, keep the two issues separate.
But you don't have to take his word for it. Several prominent medical organizations, societies, and publications have endorsed the use of marijuana for medical or therapeutic purposes, including the American Academy of Family Physicians, the American Public Health Association, and the American Nurses Associations, the New York State Association of County Health Officials, the California Medical Association, the Rhode Island Medical Society, American Medical Student Association, American Public Health Association, American Society of Addiction Medicine, Australian Medical Association, the New England Journal of Medicine, National Association for Public Health Policy, and many more. Not to mention former DEA Administrative Law Judge Francis L. Young and former U.S. Surgeon General Jocelyn Elders. In 2004, Dr. Elders wrote an editorial piece for the Providence Journal in Rhode Island, urging a bill to allow medical marijuana to pass, and it did in a large majority, passing 52-10 in the House and 34-2 in the Senate. But it was then vetoed by Governor Don Carcieri, who said it would encourage abuse, even though the wording of the bill was appropriately strict. Under the bill, a qualified patient, which is defined as someone with a debilitating medical condition, such as cancer, glaucoma, HIV, wasting syndrome, severe pain, severe nausea, seizures, multiple sclerosis, or Crohn's disease, would have to be given an identification card by the Rhode Island Department of Health, and would have to have a written statement from a physician saying that a full assessment of the qualifying patient's medical history and current medical condition shows that the patient has a medical condition that would benefit from the medical use of marijuana.
Love my day, Lord, so if you feel like I feel, then let me hear you say.
One person who has campaigned extensively against medical marijuana is Andrea Barthwell. Barthwell is a doctor and a former deputy director of demand reduction for the Office of National Drug Control Policy. Andrea Barthwell is now a spokesperson for GW Pharmaceuticals. And why is this interesting? Because the company hired Barthwell to help get a drug derived from marijuana approved in the U.S. The drug, Sativex, is made from whole plant extracts, unlike Marinol, a synthetic THC drug that many medical marijuana users find ineffective. Chemically, Sativex is no different from marijuana, the plant. It is, essentially, marijuana in liquid form. However, one of the obstacles the FDA cites in restricting the medical usage of marijuana is the lack of scientific research studies on its risks and benefits. But despite the existence of many scientists who have applied for permits to grow, distribute, and administer marijuana for medical research, the legal hurdles to actually acquiring such permits have been substantial.
The problem was we got no answer, and so you in hiatus, so you have no idea what's happening. My name is Lyle Craker. I'm a professor at the University of Massachusetts in the Department of Plant, Soil, and Insect Sciences.
Professor Craker has been trying for years to get the government to give him authorization to grow marijuana so that he can distribute it to doctors for research purposes. He's now involved in a lawsuit with the DEA over their decision to deny him permission and trying to get it reversed.
Why do you think they're taking so long?
I think they're taking a long time in deciding whether to issue this permit, although they have recently turned us down, and the reason we're going to court now to try and have the decision reversed. I think the reason they take so long is because this is a political type of decision. Their job is to keep this off the street, and this is one way of doing it, is to prevent anyone from growing it.
Marijuana has been approved for medical use in 13 states. However, federal officials continue to arrest and prosecute people, including doctors, for its distribution and use in those states. Some argue that people should go through the traditional route and get it approved through the FDA. However, the FDA continues to cite lack of evidence and research as reason to deny access, and says that Marinol is good enough when many patients who have used it would disagree. At times, it seems like a vicious circle. How can new scientific evidence be presented if the government denies research opportunities in the first place, which could provide the very evidence they require to go the traditional route? The United States government wasn't always so averse to the idea of marijuana as medicine. In 1978, the FDA created the Investigational New Drug Compassionate Access Program, which allowed people with a medical necessity to use marijuana. But in 1992, when the program was flooded with requests from AIDS patients, the program was shut down. However, 7 people still receive, every month, a silver tin of a few hundred rolled joints that is delivered to them and will be provided until the day they die. Many sick patients remain frustrated that unreasonable government regulation is hindering scientific progress on a drug that may be exceptionally useful in treating some of humanity's deadliest diseases, perhaps even cancer. One study from a few years ago tested marijuana extracts on cancerous rats. The extract was injected into and destroyed incurable brain tumors in the cancerous rats. The control rats, which were untreated, died quite quickly. In 3 of the experimental rats, the tumors were completely eradicated. I know, marijuana cures cancer. Well, maybe not. But an earlier study in 1974, funded by NIH, found that THC, the active ingredient in marijuana, slowed growth of 3 types of cancer in mice: lung, breast, and a virus-induced leukemia. Maybe there's statistical errors, or maybe, just maybe, marijuana has real potential as an anti-cancer agent. But how will we ever know if the government doesn't allow researchers to grow it so they can test?
I think what I'd like the average person or the person on the street to understand, that in talking about medical marijuana, we're not talking about recreational use. Sick people are not interested in using marijuana for recreational purposes. Sick people want to be well people. And medical marijuana offers a promise of helping people.
Make sure the mood is right, be it day or night. Let your mind take flight.
Okay.
Feel so